How are we all doing? Let's check the pulse of the room. Hello, we've spoken with Abigail already. We have Favor on the call. Hi, Favor. How are you doing today? All right. Favor is unable to access our mic. I assume Favor is female. Roddiyyat, how are you doing today? I'm calling the names by how I see them on my screen. Hi, Roddiyyat. How are you
Hi,
doing?
teacher. Good evening. I'm fine, thank you.
And we have the world famous Aproko doctor with us. Good evening. How are you doing this evening?
I'm good. Good evening, everyone.
Good evening. I hope all our speakers are ready to turn on their videos because we'll be expecting that from our speakers, and our members are also welcome to turn on their videos as well. So not to take too much of our time, as time is already fast spent. For those that are joining in, kindly drop your name, what you do, if you run a business, what business you're running, and let's see one other activity we can indulge in. Okay, yes, and where you are joining us from. So your name, what you do, where you are joining us from, and what you also expect from this session. So that means you're with us, right? So you'd be sharing the flyers on the call as we read out the bios of our speakers that have joined in. But if you can kindly share the general flyer first. So welcome again, everyone. Today we'll be having our pre-event webinar. This is one of the 4 series that we will be having before the African Women Founders Summit. And today is all about health, especially women rising in health tech. We're going to be speaking on building startups and long-term solutions to transform healthcare access across Africa. And we have just the right balance of experts to do that. So on the call, we have Dr. Abigail Osei Kumi, who is the co-founder and general partner of Friend Capital Group. We have Dr. Chinonso Fidelis Egemba, that's popularly known as Aproko Doctor. He is the co-founder of our doc. We also have Dr. Ifunanya Igweze, the CEO and co-founder of Predify. And we also have Miss Roddiyyat Taiwo, CEO, founder, Open Health, and I, your humble host, Kikelomo Owoyale, the CEO and co-founder of SheFoundry Limited. So we'll get right into it. All right, so even though it's online, I'll be expecting emojis, claps, reactions, so that we can encourage our speakers. Okay. All right. So, all right, going through Dr. Abigail's profile. Dr. Abigail Osei Kumi is the co-founder and general partner of Friend Capital Group, a women-led early-stage venture capital firm investing in women's health tech solutions across Africa and Europe. She brings 15 years of experience leading financial services business in Ghana with expertise in strategic vision, operational scaling, and investment decision making. Can we, with a resounding round of applause, welcome Dr. Abigail. Thank you so much, wonderful participants. Yes, let's keep the emojis coming in. All right, and moving on, can we have Dr. Chinonso's profile? I would go ahead and read it. Dr. Chinonso Fidelis Egemba, popularly known as Aproko Doctor, is a renowned medical professional and public health advocate dedicated to transforming healthcare accessibility across Africa. As the co-founder of Our Doc, is helping to build Africa's largest AI-driven health infrastructure, leveraging technology to address critical health challenges and empower communities. I actually follow Dr. Chinonso's work. Great work you're doing, sir, and with a resounding applause. I know I can't hear it, but by the emojis, I will know if they are resounding or not. So with a resounding applause, let's give it up for Dr. Chinonso. And then we have Dr. Ifunanya Igweze. Dr. Ifunanya Igweze is a visionary in the maternal healthcare space with nearly a decade of experience empowering women through education and innovative care models. And she's an author of 4 acclaimed books focused on maternal and child health. Dr. Ifunanya has established herself as a thought leader, reaching millions millions of women, both in person and online, with our transformative teachings. With another round of applause, let's give it up for Dr. Ifunanya. All right, more people are joining in. That is awesome. And we will be going to our last and not the least speaker, Roddiyyat Taiwo, who is the founder and CEO of Open Health, a health tech innovator, data scientist, and AI enthusiast passionate about transforming healthcare across Africa. She is a storyteller and problem solver at her journey blends personal experiences with a drive to make healthcare more accessible, affordable, and proactive. Roddiyyat Taiwo is actually a member of SheFoundry community, tagged SheFounders. So I'm very much glad to have her as part of the speakers today. So I hope we've all listened in to the bio of our speakers and we know the kind of expertise they're bringing on board. So we are looking forward to having an amazing conversation around women rising in health tech. Okay, so we would be entering into the questions real quick. All right, so our first question would be going to Abigail. Abigail, we would like to ask, what are investors missing when they overlook women's health as a high-growth, high-impact sector?
Thank you for inviting me to be part of this wonderful panel. It's a privilege to be here, so thank you once again. And thank you to the co-panelists also. Lovely to meet everyone. And also I'm going to reach out to everyone on LinkedIn after this. Women's health, I believe, is often seen as a niche, but it's actually a 1 trillion global opportunity projected by 2027. And so we have a couple of years to see it happen. Africa, I believe, holds one of the most underexplored markets within that. And when investors overlook this, I think they miss 3 main things. First is the scale of demand. Over half our population are women, and their health needs span from menstruation to fertility, maternal care, menopause, and chronic conditions often ignored or misdiagnosed. Secondly, I feel there is a data opportunity in that there is so little African-specific health data. Yet I believe that's where things like AI, diagnostics, and digital care can make the biggest leap. And thirdly, I think there's also returns linked to resilience, i.e. investing in women's health builds, stronger households, more stable communities, reduces healthcare costs long term. So I don't see it as philanthropy at all. I see it as smart economics. And at Fern Capital, we are backing founders who are building clinically validated, scalable solutions that meet real-world needs, because impact and profitability can, and I believe must, coexist on the planet. So that's my take on how, what investors may be missing in this space.
All right, that's a very nice take on women investing in women's health. You mentioned that it is a $1 trillion opportunity right now. And another thing I picked from what you said, that investing in women's health is not charity. However, it is a good investment decision. Thank you so much for your input, Ms. Afua. And then I would be asking, all right, so I would be asking Dr. Chinonso. So how do we ensure women in rural or low-income areas benefit equally from health tech innovations? We can hear you. All right.
Thank you very much for that question. Great insight from the speakers here. Looking forward to actually learn a lot rather than just speak. But one of the things that we've done, especially when it comes to building for women in rural and low-income areas, if I'm to use OEDOC as an example, is that we build for the platforms they already use. Most times the answers is not a fancy new app. For us, it was WhatsApp, it's SMS. We're currently working on a solution that embeds that entire tech into a USSD code. that even people who do not have access to fancy phones can still benefit from health tech innovation, because it's not just important to have innovation. You also need to understand that innovation has to be equitable. It has to get to the people who actually need it, which is one of the things that we're actually trying to solve for. So low spec devices, leverage platforms are already in the hands of everyone, and this is the core of our philosophy, especially behind our dog. And what we're also trying to do is to also prioritize offline functionality, but not just that, also low bandwidth design. These features don't just have to be beautiful in order to quote unquote be accessible to all the women. They have to be accessible even with quote unquote bad internet. That's the best way to put it, and that's one of the reasons why we're prioritizing text-based information, optimizing the images for this, for the internet speed, and even exploring models that can even catch some of this information for offline use, so that irrespective of where these women are, they can still get access to the information that they need. Lastly, we're also looking at community-based onboarding. We're not just launching the app and expecting everyone to adopt it. We're partnering with already trusted community figures or influencers, so to speak. The primary healthcare centers, the people in these villages, the women, so that these women can continue to get access to the services that they need. Unconventionally, I would say things like skilled birth attendants, traditional birth attendants. Those are part of people that we also want to reach out to, because we've understood that these women have the trust of the community, and it's also important to use them as a gateway to the rest of the women in the community. So trust is one of the ways that we're using to ensure that women in rural and low-income areas benefit from this health tech innovation. Thank you.
And I really love what Bobby just shared, in that I think a lot of especially in global north, there's a lot of tech. But I've always believed, how do we reach women in my village? How do we reach women in my mom's village? And that is always at the forefront when we are looking at ventures on the continent. So I'm really happy to hear about what you're building. I'm going to be in Lagos at the end of October. So I'd love for us to connect.
I will. Thank you for that.
I could see Aqua smiling, and I knew why. I knew the reason why she was smiling. But yes, I don't know if Dr. Chinonso is still fundraising. At some point, I knew you were raising some funds, but are you currently fundraising at the moment?
We still are. We haven't completed our raise, but that hasn't stopped us from actually ensuring that this product is actually in the hands of people who need them.
All right. So Dr. Alpha is someone you should actually connect with, as they heavily invest in women's health. Okay. Let's get it moving. So yes, lovely input, Dr. Chinonso, and I'm very impressed with what our doc is currently doing, especially for women in rural and low-income areas. I know Rise Africa, they've changed their name. Actually, they also had something similar, but in the agricultural space. So it's lovely that someone is thinking about how to get this access to medical facilities, access to medical opportunities to women in the rural ecosystem. And that's why that question was specifically targeted towards our doc. All right, let's get it moving. So I would like to ask Ifunanya, right? Dr. Ifunanya, what's your vision for women's health in Africa in the next 10 years? And what must we start doing today to achieve it?
Yeah, thank you so much. I'm super excited to be here, to be in the midst of these great people. I feel so excited being part of this conversation. And women's health for me is not just about being a doctor or because I was trained in medical school. It's something that I've lived and I've experienced both the positive side and the negative side. Being a mother and someone who also lost a pregnancy in the process. So it is something that I've seen. I've seen it happen in villages because I grew up in the village. I spent most of my life in the village. I know, it's not like what they used to be. I know a traditional birth attendant house. I know what happens there. They just live behind us. My mom had our last born there. So I know these things, I know how it works. I also lost my younger brother to vomiting and diarrhea before the age of 1. So it is something that I have lived, I've experienced. And so the push to see a different maternal care for women, it is not born out of big English or because it is a trend. It is something that is a necessity. And when you look at our environment, you see that we have unique problems. When I was in Anambra State, I had a non-profit that goes to villages to educate women, do demonstration for them and all that. And when I moved to Lagos in 2020 to join my husband, I thought I was going to, because I've been hearing about Lagos, I used to visit but never lived for a long period. So I thought because then they'll tell you, when we start writing on social media, people were like, stop at this thing for writing on social media, go back to the village, people that need it are in the village. So I was expecting that when I come to Lagos, I'm going to see a very brand, elite healthcare community where people know what to do. People are not going to succumb to avoidable deaths, but it was the same, because that is one of the mistakes we usually say, people that live in urban day. No, you go to the hospital in the village, you see things, you come to the city where you expect a different outcome and then you are still seeing. But the only thing is that the factor or the determinants of these things are just different. So for us, what we are currently doing at Credify for and where we are seeing maternal health in the long term is that we begin to reimagine the kind of care women are receiving now. With the old antenatal care, the routine antenatal care that was designed for my mom, my great-grandmother, and people before us is not really fitting into the kind of care that women want to experience now. So we need to do something different for them. Women want a care that is personal to them. Women want more listening ear. So we need to have an overhaul of the current maternal care that women are receiving. When you interact with women, you see that the word they will keep using is dismissive, because our mothers never asked questions, but the women now, they're asking questions and they don't want to be dismissed. So we need to have redesigned the maternal care system, the pregnancy care from pre-pregnancy, pregnancy and post. We want to make it a way that it is more compassionate and it listens and it gives people what they want, not treating them like an entire group of pregnant women, but isolating cases and making them feel that, this particular care was given to you because you are this and you're experiencing this, not because we expect everybody to be treated this way. And then secondly, I want to see a maternal health care in Africa where education is at the forefront. As a doctor working specifically with pregnant women, I would tell you that when women are educated, thank God Aproko doctor is here and he knows what I'm saying. When women are educated, you see them participate in their own health. Like today, a woman, we run a 24-hour pregnancy support for women, right? And then we're very big on education through our pregnancy academy, which something is coming up with Aproko doctor too there. But you see that this woman just reached out today and said, "Doctor, my baby is not kicking." And she said, "I have done my fetal kick count and it is not convincing." I was like, yeah, that's what we're saying. This woman is already educated. She knows that if your baby movement is reduced, it is a danger sign. And she even went further to validate it. And she said, "I just want to inform you guys, but I know I should move to the hospital." And then this evening, she followed up and said, "They have done a biophysical profile, they have observed me, the baby is doing well, and I'm going home." This is what education can do in the maternal health care space, and we are really putting big on that because the social media space is filled with a lot of information. Even with monetization, people just copy a post, replicate it, and post because they saw that, oh, this person made this post and it went viral. So they just copy it, paste it on their video, and they don't know the why behind whatever they are saying. And then mothers too are beginning to speak up on social media, and they tell their experience without creating boundary between what they should share as people and what they should not share because they are not medical professionals. So you see mothers who feel like, oh, because I've given birth before, I am now experienced to become a mini doctor or a mini midwife to share this kind of medical advice to people. So we want to build in the long term at a space where we can have a platform with so many trusted voices where the women can say, even if I do not believe any information I am seeing on Google and YouTube, if I go to Pregnify Pregnancy Academy, I can trust whatever I am getting there. And this is the ecosystem that we're building, and we're hoping that it's going to be a platform in the next 10 years. It's going to be a platform, something like a YouTube for maternal health, where women will specifically go and say, I am learning about maternal health on this space. So it's part of the things that we're doing. And then finally, in the 10 years, I want to see a space where women are leading their own care. Women are in the forefront of their own care. They are no longer just following whatever the doctor said, but they're in the forefront. They know how to monitor themselves. They know how to take their blood pressure in pregnancy. They know how to track it. They are in the forefront. They are the one that is providing the information. They are the one that is saying, no, even though I understand you're a doctor, but this is how my body feels now. This is what exactly it is. So I want women to lead. And what can we start doing today? We already started, we already started without permission, without, figuring it out completely. Pregnify started on WhatsApp, where we had a community, women asking questions. But at some point, we noticed that we needed to scale the academy. We needed to scale it in a way that it can accommodate more, a more structured way for these women to assess this on the go. And in order to...
Thank you so much, Dr. Ifunanya. You can see that she's so passionate about Pregnify. Like, as you were speaking, I just felt like, when should I become pregnant? Oh my God. It's so you make it look so fancy. Thank you so much. What you do at Pregnify? Oh, there is an echo. Please give me a minute. All right, I'm back. So what you do at Pregnify is quite laudable, well done, and the vision behind it is also quite impressive. You've mentioned that you want to see equitable distribution of healthcare. You also mentioned education as one of your top priority at Pregnify. I also do agree. There are lots of cases that we see. My brother is a medical doctor. I think that's even one of the reasons why we are actually having this conversation, because I've heard a whole lot of funny stories about women's health and then them not being able to access certain healthcare because their husband is not approving to this. So if they have some level of education, I believe we would not have such occurrences. All right, so let's move on to the next question. I know Roddiyyat is already waiting. She's like, when are they going to get to me now? Don't worry, Mama, we are ready at your time. Okay, just give me a minute. Okay, so for open health, how can women founders in healthcare, how can they balance profitability with social impact in a largely underserved market? And we are asking this question because we know that you currently run an health tech company. So how can women founders in health tech, how can they balance profitability with social impact?
Hi, teacher. Hello, everyone. It's so nice to be here. And I can see Dr. Ifunanya, who I really admire, and I can see a doctor. And it's so nice to meet you, Dr. Abigail. So yeah, I actually feel like this question should be tailored to people that have built for years, because we are just starting out as open health. So the question about sustainability and profitability, but I like to say my life is an experiment, and I'm just going to share my lessons so far. And I think it has to go hand in hand, especially in healthcare, because you can't just focus on profitability in healthcare. It has to make impact on whichever customer segment you are targeting. And I think that's why I'm really excited about what we are doing at Open Health, and why it is definitely futuristic, because we are focusing on preventive healthcare, and we are saying we do not want you to fall ill before visiting the hospital. And preventive care is not something Africa or even Nigeria practice. So it's very interesting talking to people and realizing that everyone has their own thinking about how they want to experience healthcare and the type of healthcare they want as individuals, and we're trying to provide that for them. So I think we've been building for more than a year, and it's been very interesting learning about the entire ecosystem and also growing as a company while also trying to make sure we are making impact in our users' lives. So I'm just going to say it's something that has to go hand in hand, and rather than just focusing on building a startup, it should be something sustainable. So we are trying to build a social enterprise. So I'm still learning. I'm still like trying to understand everything as I go. But yeah, it's been very, very interesting. And I'm glad to have people ahead of me, like I mentioned, that have done it, that are still doing it. I think there's a lot of gap in Nigeria and Africa healthcare system. We definitely need a lot of young builders like myself, and we need a lot of females building for healthcare, most especially because I think we females see things from a different perspective than a lot of people do. So it's going to be very interesting seeing what comes out of the ecosystem in a few years, and I'm super, super excited. Thank you.
All right. So since you decided to put me on the spot, saying that I shouldn't have asked that question, I'm also going to put you on the spot. Okay. So you mentioned that there are lots of gaps that you've seen that exist in the healthcare ecosystem. So do you mind just running us through one or two of those gaps that you feel like there's something that needs to be done in those particular area?
Yeah, definitely. Something that has been on my mind a lot lately is actually how people living with disability access care in Nigeria. A lot of hospitals do not even provide access for people. And I'm actually focusing on people in the deaf community, because I do a little bit of sign language, and I've been privileged to meet a few of them, and then talking to them and then being able to narrow it down that apart from the general deaf community, women, especially pregnant women and those breastfeeding, have a major challenge accessing healthcare across Nigeria and even Africa, because very few doctors understand sign language. Further hospitals, public hospitals, none of us have a sign language personnel when you enter the hospital. So a lot of time, there's always a third person barrier when these people want to access care, which is usually a translator. And most times the translator can't tell the doctor what you are feeling. So there's always that challenge of the middleman when they're trying to access care, or even sometimes those that can't afford a translator or a family member can't do sign language. They have to write down in a pen and paper and then show the doctor. So there's a huge gap in miscommunication there. And I know, like, just understanding the community a lot more, and then I know we can build tech solutions that can solve some of these problems for them. But it's very interesting. And also given the statistic that we have close to 30 million Nigerians that fall under this category of people living with disability, and almost 10 million deaf and dumb people. So just understanding that particular segment that is totally left behind by digital health, and knowing that there's a lot more we can be doing to help these people, the women, especially the pregnant women, the women that are raising kids. So it's very interesting just discovering that and knowing that we can't turn a blind eye to a solution like that. We have to come up with solutions for them. So yeah, that's one of the things that's actually been keeping me awake throughout the night. So yeah.
Wow. Wow, I think I've learned something new today. This is a segment that I wasn't aware of. Thank you for enlightening us. And are you saying that Open Health is currently building a solution for that particular segment?
Kiki, don't worry. When it's out, I'll let you know. But I can't confirm or deny anything right now.
Interesting. She does not want the cases of those that are found cure to cancer, and then before you know it, they are no longer to be found. So she does not want the government to come for her. I understand. I understand.
No,
Oh my
it's just
God.
that we don't want to rush into anything. It's a
Into anything.
delicate community, and they currently have a different paying system, and then there's a whole lot of NGO activities involved. So we want to be sure what we are getting into. Yeah.
All right. So we'll be rounding up soon. If you have questions, because we respect everyone's time here, if you have questions, please start gathering them so that you could ask our speakers. Apropos, Doctor, I would like to confirm if you're still with us, as your video is not currently turned on. You're still with us. Awesome. Okay. All right. So this question goes to Apropos, Doctor. So what policy changes are needed to ensure gender equity in Africa's health innovation ecosystem? So this is now talking about the macro side of things. You know, you've mentioned the micro and how our doc is trying to solve those gaps. So the macro side of things, what policy changes do we need to see in Nigeria and Africa for gender equity in healthcare?
I'm so glad that you mentioned it, because the policy changes that we're looking for have to first start from the head itself, which is the policy makers. I think last month I was part of an ongoing campaign called the Reserve Seats for Women. And one of the reasons that we're part of that, I think it was spearheaded by Osaso. And one of the reasons that I was, part of that is because a lot of the struggles that we're facing, especially in maternal and child health, are not really problems in countries who have reserved seats for women policies, women as policymakers, because it's very important that when women become policymakers, especially in Nigeria, there will be better adherence, especially to the policies. It's just a given. Countries like Rwanda have also been, shown to implement this and have the good results to actually show for it. Another thing that we also need to do is, when we say we're funding women, we need to fund women intentionally. Policies that mandate a certain percentage of public innovation funds and grants to be allocated to, health tech, women-led health tech startups, so that venture capital actually, follows policy. We already have countries like Kenya who have certain policies, for instance, that have companies devote a certain portion of their CSR to funding startups. We need also policies that say, okay, certain part of CSR, especially in Nigeria, that should be funded towards policy and sure, it should be funded towards or channeled towards innovation that actually are towards women. Incentivize gender-based innovation. For instance, tax breaks, things like that. And it's also very important, and I think that is also something that we need to look at when we're integrating digital health. We also need to integrate digital health into digital strategy. Health tech doesn't need to be seen as one of those things that is just there. It has to be seen as a core part of our national health infrastructure, not just as a side project. This means that we're creating, clear regulatory pathways for digital health solutions and ensuring that they are also integrated into our primary healthcare system. It is very important. This ensures that we make really fast decisions and are able to have a real-time overview of what the problem is, especially when it comes to women's health.
Wow. Okay. I'm trying to digest everything that you've said. Okay, so first you mentioned that women need a seat at the table, and I totally agree with this because it does not make much sense for us to have men deciding on what happens to a woman's body without them having to have walked in those shoes. So it is important that when we are making policies about women, then it should be done by women. So I totally agree with that. And then you also mentioned funding for women, that the nation should also be involved in this, especially having regulations that have to do with CSR being targeted. Sorry, a minute.
Especially programs like family planning, sexual and reproductive health should be spearheaded by women.
I agree. Because there are some funny arguments that happen, but I don't want us to get into it, especially when it comes to abortion and some other things. And then men will be telling you that, no, this should not be. You are not the one with the pregnancy. You're not the one carrying. And I know that we are a very religious country. There are some things that are also influenced by religion and culture. But if we have women at the table, at least they should see things from our own lens as women. So you also mentioned funding for women. You mentioned incentivize gender-based innovation. And in my head, I'm like, is our doc asking for tax break? Our doc.
not necessarily asking for tax breaks. I think before our doc, as apropos doctor, the apropos doctor foundation, or a lot of our funds actually go into cervical cancer screening. I mean, recently we had one in Maryland where we screened over 600 women for cervical cancer, free of charge. And this comes from donations from the public. So tax breaks for companies,
such initiatives.
Yes, because one thing that it does is also incentivizes women and ensure that we can reach more women.
Yeah, that was actually on a lighter note, but thank you for expanding on that. Thank you for expanding on that thought. What did you say?
I'll take tax breaks if they come.
And then you also mentioned digital health, being intentional about digital health. I think there was a frenzy. There was a particular time that there was a frenzy in the fintech ecosystem, but people are now starting to see beyond that, and then starting to see the parts that would actually make social impact as well as also profitability. And that was the question that was directed at Dr. Afua initially, where she said, investing in women's health is not just charity. You are actually going to make profit from this, and also the social impact side of things. So it's high time that the government also sees to this and also create policies around that. I know that there's a Startup Act. There's also the new act that has to do with tax and all of that for startups. I think those things should also be looked into, and when they are creating those acts as well, the digital space should also be considered when they are creating such. So very laudable submissions. Let's move on to Dr. Afua. So if any participant wants to add to some of the questions, you are very much welcome. I think Dr. Afua did that initially. So we're going to move on to Dr. Afua now. How can we then build stronger partnerships between public health institutions, venture capital, as well as impact investors to expand women's health access? You are muted.
Yeah, no, I was saying that thanks for everyone's, submissions so far. It's almost as if like my eyes and my ears are all peeled. I really love this. Yeah. It's always so interesting speaking to other, partners in the ecosystem. And with reference to partnerships, partnerships matter because I believe no single player can close the women's health gap. Public health institutions bring reach and credibility. Investors bring capital and speed, and I believe impact partners bring depth and patience because they have that ability to catalyze their capital and then manage and sustain change. But what we often lack, I believe, is possibly translation, the ability to move from pilot projects to commercially viable models. Co-investment frameworks and data sharing partnerships can be transformative in that governments can de-risk early innovation through grants or first loss capital. VCs can bring market discipline and growth capital. And impact investors can sustain scale through outcome-based funding. So when we blend these strengths, which is the public insight, the private capital, and social intent, we don't just expand access to care, we build an ecosystem where innovation also becomes equity. Yeah, so that's my hot take on how partnerships can be used in the space.
Thank you so much, Dr. Afua. I got distracted a bit. I am so sorry. But yes, it's important that all of these players come together in order to promote women's access. If I'm not mistaken, that was the submission, right?
Yes.
Amazing. All right, let's move on to Pregify. All right. So how can we inspire more young women to pursue careers in health technology and innovation?
Okay, thank you. I wanted to say I'm still a young woman, but then I remember what the young definition is currently in Nigeria. So I'm actually old. So the first thing that we need to do is show them what we're doing. Apart from all the talk, all the motivation, show them the way. It's not about just organizing seminars or this. We need to actually show them practical ways without trying to make the road, trying to let them go, tell them things that are ambiguous and let them go and figure it out. When I got into healthcare space, trust me, I didn't know any human being that was in health tech. I didn't even know what health tech was. And I'm telling you, this was just 2022, right? I just moved from the clinic and I had one ugly experience in the clinic. Then while I was still processing that loss of that patient and the baby to preeclampsia, I lost my pregnancy and I said, guys, we're done. I opened my email, cancelled my PLAB exam and said, let's die in this country. I cancelled my PLAB exam and stayed. And just moved to WhatsApp and said, women, you guys need to be heard. You guys need access. So I didn't know anything. And it was even someone in fintech that picked me later on, like I think 6 months later along the line, and now asked me, so who is helping you with the health tech? I said, health tech, what's that? I'm not ashamed to admit it. I said, health tech, what's that? And he was like, okay, but do you know what you're doing in digital health? I said, no, I don't know. And that was how this person started giving me, practical guides. Like, I'm not telling you about motivational speech, like practical guide. This is what it is.
Inspire to perspire.
It's not that, sending me real resources that I need to learn directly without, telling me I go and research and come back now. They went there. So this is the kind of thing that we need in health tech space, where we are practical in what we're doing for the younger generation. And also, secondly, we need to start circling back to medical school. Not just doctors, nurses, pharmacists, physiotherapists. We need to start circling back to medical school to let them know that clinical medicine is not the only medicine out there. The world is changing, and there is a career path. That is a whole career path out there that does not just confine you to the clinic. There's a whole lot, because I would say that health tech falls into public health. There's a whole public health tech pathway that is out there, And then finally, when these young girls, put interest in what to do, I think that apart from like giving them mentorship, we should be able to be their sponsors. I'm also still looking for a sponsor, but when I blow, this is something that I want to do, not just be mentors to people, telling them in words what to do, actually.
Pregify, we know you've blown. Don't say when you blow.
Don't chase away. See firm venture here, don't chase away my help out, Let's sponsor them. Let's actually give them real access. When I talk with people that are ahead of me, I want access. I want real network. I want practical things. I want someone that can say, you know what, take this. It could be money, it could be real access to community, it could be cutting me off from, okay, you have been going to this office for the past 6 months and they're not listening to it. Or come, hold my hand and go into the main office and do it for me. That's sponsorship. So this mentorship thing works, but we need more sponsors, in this space. And that is what we should do for ourselves, right, and translate it to other future generations.
Thank you so much. Especially the part of the sponsors, because this is also one of the conversations we always have in gender-led investment. It is not just enough to mentor women. Women are actually tired of mentorship. What do you want to mentor us again? So we need that funding, the necessary funding to be able to push and thrive, especially in the entrepreneur ecosystem. Does any other speaker have additions to that? How can we encourage young women to get into the healthcare ecosystem? Anyone? Afua? You're muted.
Yeah, I was going to say that I think it will be useful for, I guess, women, getting into healthcare. Also, to not only think of designing solutions around moments, because I don't think a woman's health journey is necessarily a moment in time. It's over a life cycle. It doesn't begin or end with childbirth, for example, because it evolves from adolescence through, menopause and beyond. And the data also tells us that, African women, for example, lose more years to preventable conditions, including what Pregify is trying to do, which is maternal complications. But then also, again, we have later, diagnosed cancer, for example. We have metabolic diseases, diabetes, heart health. So there's a whole spectrum of areas that I feel women can sort of get involved in. But I think a lot of the time when we think of women's health, we're only thinking of reproduction, and I feel it goes beyond that. Because I think even recently I was reading some data on anemia in the world, and it says that African women are disproportionately affected comparative to other women in the world. So I feel that we could be looking at so many different things. Just reproductive.
Yeah, so your advice for those who want to build in the ecosystem is not just focus on one part of the segment, but there is a lot to still explore. All right. Okay, let's move on to Roddiyyat, and this would be our final question. So what role do communities play in co-creating effective health tech solutions for women? What's the role of community in all of these health tech solutions that we are building?
I think that's a very interesting question, because I recently had a renewed purpose about building human-centric AI for healthcare, most especially. And because I'm of the opinion that a lot of healthcare solutions leave behind 90% of people, especially people in the grassroots. And I also feel like we are contributing to that, even with our solution at Open Health. It doesn't carry everyone along, and that's something we are trying to change. And I'm so glad we have panels on this panel. Yeah, and I remember listening to Dr. Ifunanya, and she said when Pregify started, they started on WhatsApp. And I know I've used our doc. I know our doc is also WhatsApp enabled, which millions of Africans use. So I think that's a very good starting point, meeting people exactly where they are, because WhatsApp is a huge community on its own that is really untapped into. So I think building more simple solutions like that is really functional and can do what you need it to do is actually the first step of building human-centric solutions, health tech solutions, most especially in Africa. And also understanding that there are various stakeholders in healthcare, and you have to try to get everyone on board so you can provide a visible solution to them. And I remember being on a call, and I just want to add to what Dr. Ifunanya said about sponsorship and stuff. And I remember being on a call with a coach, and she literally told me that I need two things, which is I need a lot of patience and I need resources and connection to continue to build for health tech long term. And I laughed and I told her, I don't have patience, so I'm going to try to give myself a lot of patience. But for the resources and connection, I'll try to get as much as I can, because building in health tech is a long journey. I've built for a year plus. I honestly feel 10 years older. So people that have been doing it for several years, you guys, kudos to you guys, literally. I can't do what you're doing. So it's crazy, but it's also really exciting, because every day you're confronted with the problems and you just have to find a solution. There's no running from it. It's like Dr. Ifunanya said, you can't run from it even if you try to. Whether you're in the country or not, you still can't run from it. So our best bet is just to sit down with it, confront the problem, and build, work with the communities involved, and try to make their life better. Because whether we like it or not, doing that, we also get a type of fulfillment, and we feel like, I don't know, it's just I know I feel fulfilled with what I'm doing, and I think I'm still going to be doing it in the next few years. So yeah, fingers crossed I get the patience I'm looking for, and then the resources to keep doing it. So yeah, we definitely need community as we go, whether it's a community of mentors that I'm surrounding myself with, or even a community of people, like I mentioned earlier on the call, people living with disabilities. So just finding those little ways to contribute, I think, is one of the things that makes it worth it for me. So I think I've said a lot of things, but yeah, thank you.
I think I would add also that communities, is everything. Women's health tech doesn't succeed because of code. It succeeds because of trust. And you can't scale dignity without proximity. And going back to what, Pragify, I guess shared with us, that, it's because the women trust her. They trust in the solution that she's building. Because firstly, maybe because she's a doctor, which, ensures trust. And even when you said, you could sign, I was like, oh, wow, that's like such a beautiful thing. And I've never really thought about how deaf, women communicate when they go to the doctor. It had never crossed my mind. Yeah, because I just don't happen to find myself in that situation, and I don't have anyone in the immediate family who even, maybe has that problem, or know of anyone who has that concern. And that sort of trust can only be built through community. So it's great what you're trying to do. And I would love to meet everyone when I come to Lagos, please.
Definitely.
Yeah, thank you so much. I just want to add something on the conversation, because when we talk about community, when we're setting out to build for women, the first thing that usually happens is building from our own perspective, building from our own view, perceived need. In public health, there's something called actual felt need and perceived need. So the first time that we started to build Qualify, even though I have seen this thing happen in the hospital, right, it was still my perceived need. Maybe I had an advantage because I am also a mom, so I've always been on both sides, but it didn't still give me a round or complete perspective of what women can do. And do you know what happened? When we started building platforms, our web app failed. The first app we built failed. We built another app and nobody knew about it. I'm not saying that nobody knew about it. Before we now went back and said, you know what, let's have a conversation with these women. And we start asking them, what do you want? We know you have other pregnancy apps from US, UK, but what exactly is missing in those places that you wish you're going to have? And that was when they started talking. And we redesigned this current one, sent it back to them in the code and said, does this feel like what you want from us? And they said yes. And then we went back. For every stage we were building, we were sending back to them and say, are we still in line? Is this what you want to use? Does it feel like, even the colors and everything, does it feel like what you want? And that was why when we launched this, and we were like, okay, let's just see if we can get like 100 people to use it. And in that space that we said we'll get 100 people, we get 1,000 without spending on ads. And we said, okay. And even with that 1,000, this time around, the Pregnancy Academy had, as of 1 month ago, it had 80,000 visits in 1 month from just less than 1,200 users. So it tells you that this time around, you know what? This is what these women want. So that two-way conversation has to come in when you're building for them, because every demography has a social determinants to their health. If you're building for people, poor community, they have a social determinant. If you're building for suburb, they have a social determinant. And if you think that what works in rural community is that social determinant that is going to affect someone living in Lagos, Port Harcourt, Abuja, suburb, or no, it's not going to work. So that conversation has to happen for you to know exactly what their pain point is and what you're building.
All right. It seems our speakers don't want to. Oh, Amadok, you want to contribute to it?
Yeah, I think it feels like we are looking into each other's notes. One of the reasons why this is happening is because almost everyone here, rather, especially the speakers on this platform, are actually building locally viable solutions. And one resonating points that you always know is that the consumers, or rather the community, is not your end user. They are in your R&D department. They are the people who are actually helping you build the product for them, rather than we're going to build a product and we just expect you to use it. When we look at the viral platforms, especially in Nigeria, when it comes to fintech, you hardly find a lot of ads. What you find is trust within the community. This person says, I've used this particular, platform, and I think you should use it too. And when, there are certain questions, when you used it, did it give you any problem? I think this also helps us with how we build our doc, especially when it's something with AI. When we looked at AI and then we looked at the local adaptation of this particular technology, one of the things that we had to really pay into, really bring into attention was bias. Because when we say AI, most times the AI is biased based on where it's trained. One of the things that we started doing was exposing our app to local women, local, people, local Nigerians, getting them to interact with it, and now using that information to now further build for them. So long as we understand that, look, the community, they're a source of truth, they are a distribution network, and they also provide the feedback loop rather, we would continue to build solutions that actually solve problems, not fancy ones.
Not fancy ones, and I think that's a very good way to end the session. So build for the communities, build with the community. Don't build in isolation. Have your end users in mind and let them also be part of your R&D. So those are the key takeaways from that last question. Thank you so much, our panelists. Do we have any final words? Any final words for the audience?
Yeah, I think mine is just more of a statement, and it's petition for our Aproko Doctor to be our next Minister of Health. I think I'm going to get my PVC on board, so why not? And Dr. Ifunanya, I'm going to be in your DM, so you're someone I really, really look up to, and I'm super excited to yeah. And Dr. Abigail, I'm going to reach out.
Yeah. All right. Any other person? Any final words? Shoot your shots. Any final words?
All right. When women rise in healthcare, entire systems rise with them. I guess when I saw your title, that's what I was thinking. And I guess at FEN, our North Star is very, very simple. Invest where purpose and profitability intersect our lines. And where better health for women translates to better futures for all communities. Because all of us sitting here, we were born by women. We cannot be women. You have a sister, you have a mom, you have a niece, you may have a daughter, you may have a friend, and they may be women. Why are we ignoring, and also are the majority in the world? We can no longer be ignored, I feel. Yeah.
All right, I totally
women as allies is always a beautiful thing, Doc.
What did you say?
I said to have men also as allies is always a beautiful thing.
Yeah, it's always a beautiful thing. Yeah.
So thank you, good Doc.
Thank you so much.
Aproko Doctor, Ifunanya, interested. Yeah. Okay. All right. So that's all. Final words, Aproko Doctor Ifunanya. I trust Ifunanya. I trust her. She will have something to say.
First of all, so I want to say thank you to our doctor, because sometimes one of the hindrances that we have in this space is trying to talk to someone higher than you, someone that is already blown, and trying to sometimes when you want to reach out to them, you have a lot of what are you going to offer them? How do you even impress them and all that? But something happened recently, so we're trying to launch something at Spotify, and I was like, oh my God, how do I even talk to him? And one day I just opened WhatsApp and I typed, oh, this is what we want to do. On WhatsApp, I did not send an email, on WhatsApp. And he responded and said, yeah, I'm in. I was like, hold on. that alone gave me, I was in my lowest moment, and I said, no, because something happened in trying to get a public partnership, and I was like, I need to figure another way to, do this. And that's even like immediately he said I'm in, it's as if someone gave me 100k USD to go and continue what we're doing. And I felt alive.
The man is flowers.
Yeah, I felt alive. So, and when I reached out to other people, the smaller guys, and I said, I write to them, I say, oh, I want to be there, I want to be there. So
you're right.
Thank you so much. And I look forward to us having an integration between our dog and Pregify, because people in rural areas, some of them can also connect with Pregify and find to see where we can complement what we are already doing. And therefore, Dr. Frey, I'll be expecting to, you are a CEO. To be honest, we have not raised, and it's been a kind of women-led, impact-driven, Are you sure you guys?
Don't worry, you are writing as space. You don't need to pitch yourself too much. Your product will do the talk.
Looking forward to having that conversation. And to the rest of the people here, thank you so much for showing up. Women's health needs attention. It needs urgent attention, because losing one woman is very, very sad. And when I went to Rwanda for my master's, the kind of school I went to there is a US-based school, and you see that these people, even though they have it all in the West, and they brought this school here, they want you to actually have a co-creation mindset from the beginning. They don't want you to just impose things on people. So we need to start working and changing our mind to say, how do we start building, co-creating with women to make things work for them, instead of imposing what is flexible or what we feel like we need for them. Yeah. So thank you.
All right. Even though Dr. Ifunanya has gone into serious mood, I'll take her back. She's a saleswoman. She sold herself to a Aproko doctor. Integration. Already talking integration in this call. I'm going to get my commission. So it's lovely hearing your submission, Dr. Ifunanya. And then can we have Aproko doctor? I don't know why you became Bobby. I did not see Bobby in your full name. But yes, can we have your final submissions?
I think I want to thank everyone who's been on this space. Hearing actual solutions reaching women fills me with great joy. I've always been someone who's been inspired by solutions. I'm tired of talk. We just talk, we have policy meetings, we sit down, we have panel sessions, and we'll come back the next year and repeat the same thing. But seeing the actual solutions get into actual people is actually very inspiring. I'd love to connect with each and every one, especially after this meeting, so that sometimes I can steal ideas, especially for some people. Thank you very much, everyone.
All right, thank you so much. And so we have finally come to the end of this session. It just feels like it shouldn't end, but yes, it has to. Thank you so much, our line of experts, line of panelists. We really do appreciate the conversation. Has been so super interesting, and I'm glad that we're able to have this session. I'm just going to add, Aproko doctor also responded via WhatsApp. He has even agreed to it before I had any conversation with him. So I think that's his style and that's his thing. Thank you so much for your humility, and thank you for always willing to give back to the society. We really do appreciate that. Can we have our audience turn on their cameras so that we can have a group picture taken together? This is not a physical session, but we want you to feel like you attended a physical one. So if you could turn on your camera so that our creative director can do his thing. All right, so can we have comfort? And while we're doing that, I'd like to spotlight the team that gave in their all and their best in making this happen. Shout out to Elo Ogene, my personal assistant, and shout out to and shout out to Comfort. I saw Esther on my screen and I was saying Comfort, don't mind me. And shout out to Comfort, our operations officer. All right. Okay, so we have people turning on their cameras already. So thank you, team, for making this happen. Our panelists, even though Dr. Afua gave us breakfast and said she will not be in Lagos on November 15th, but yes, you are all welcome to African Women's House.
From the 27th to the 31st of October. So I'm there from a Monday to Friday, and I would love to meet everyone that I've met here. It will be amazing.
Yes.
In real, right. Not just behind the screen. So
okay, definitely we would love to meet you as well.
Yeah.
All right, but I hope you'll be able to join us virtually for the event.
I will try my very best.
All right. So she said she's going on vacation and she does not want to be disturbed during that period. Oh my God, God when. But yes, everyone is welcome to African Women Founders Summit, happening November 15th, 2025 at Eco Hotel and Suites. Do not worry, our panelists, you are getting a special guest invitation. Comfort and Elo will make that happen. All right. Okay, seems most people are not available to turn on their video, but can we have this taken? Damilola, can you confirm if you've taken the pictures? All right. And to that, we say bye, everyone. Thank you so much for attending this session.
Thank you so much for having me. Thank you.
Bye, everyone. You take care.
Bye. Bye-bye.